Hi everyone. So our next chapter is chapter 14, talking about cardiac output, blood flow, and blood pressure. This builds on chapter 13 where we talked about heart anatomy and the cardiac cycle. And now we'll discuss more about the calculations of cardiac output and then how that affects flow and blood pressure. Okay, so we'll start off with the equation for cardiac output, which is heart rate times stroke volume. And average cardiac output is going to be about 5 to 6 liters per minute. This is a function of the heart rate in beats per minute and stroke volume, which is measured in milliliters per beat. And we calculate stroke volume by taking the end diastolic volume minus the end systolic volume to get this 70 milliliters here. Take 135 minus 65 for 70 milliliters for stroke volume. Okay, so stroke volume essentially is the amount of blood pumped with each heartbeat. Okay, on average, something about 70 milliliters per heartbeat. When you multiply heart rate and stroke volume, then you get cardiac output. Now, there's lots of ways to regulate cardiac output. We'll talk about these today. And so if you look at this cardiac output as a function of cardiac rate or heart rate and stroke volume, we need to think about the inputs that are controlling cardiac rate and stroke volume. And in this figure, a solid line means it has a positive effect on that trait, and a dotted line means it has a negative effect. So here's the parasympathetic nervous system activity, which you already know is going to have a decreased effect on cardiac rate, right? So parasympathetic nervous system activity is going to decrease heart rate, while sympathetic nervous system activity is going to increase heart rate. Sympathetic activity can also increase cardiac output by increasing stroke volume. So in addition to increasing heart rate directly, it also increases contraction strength, which increases stroke volume. And now you have a greater effect on cardiac output of sympathetic nervous system activity. The inputs to stroke volume include contraction strength and end diastolic volume. So end diastolic volume, the amount you have left over at the end of diastole, and stretch by way of contraction strength are going to increase stroke volume. And total peripheral resistance and mean arterial pressure are going to resist or have a negative effect on stroke volume. So we'll talk about all these things in detail. Let's start with cardiac rate. Here's what it looks like when we look at the effect of the autonomic nerves on that SA node. Remember, the SA node is your sinoatrial node. It's the pacemaker of the heart. And so we look at the effect it has on the pacemaker potential. Okay. What we find is that the action potential rate and the amplitude don't change, but the time to reach threshold does change. So here's our basic control SA node, and you can see the pacemaker potential here below threshold. When you stimulate this with a sympathetic nervous system, you see heart rate going faster because this pacemaker potential here reaches threshold more quickly. Parasympathetic has the opposite effect. It takes longer to reach threshold, which means you're going to have a slower heart rate. But you'll note that the amplitude and the action potential shape of these don't change. Okay. So we have this opposite effect of sympathetic and parasympathetic activity on heart rate. The increase in heart rate with sympathetic nervous system activity happens by way of norepinephrine. So sympathetic nervous system activity and norepinephrine increase pacemaker action potentials. A decrease in heart rate is achieved with parasympathetic nervous system activity and acetylcholine. So these are going to decrease the pacemaker action potentials. In terms of regulating stroke volume, there's 3 ways in which we can do this. Okay? The first is the Frank-Starling law of the heart, which is a relationship between that end diastolic volume, contraction strength, and stroke volume. And if you stretch the ventricle muscle, it will respond with more force to push out blood. Okay? So stretch the muscle, makes it have more force to push out blood, which means cardiac output will increase. Okay? The second way to alter cardiac output by changing stroke volume is by increased total peripheral resistance. So when you have peripheral resistance in the arteries, it's difficult to pump blood from the heart, and so cardiac output will decrease. We also have extrinsic control. So sympathetic nervous system activity, in addition to changing that heart rate, can also increase the strength or the contractility and the rate of ventricular contraction, which is going to increase cardiac output. So sympathetic nervous system activity can increase stroke volume via this pathway of contractility. Okay. So the next thing to talk about is going to be some of these fluid mechanics, fluid dynamics of blood and blood flow. And essentially then we have two fluid compartments to think about: intracellular fluid and extracellular fluid. We can further divide the extracellular fluid into interstitial fluid and blood plasma. The interstitial fluid being the fluid that's not in blood vessels and not within cells. What you'll notice here is that there's way more liquid intracellularly than there is extracellular. Okay, so the majority of the liquid in our body, the fluid in our body, is in cells, not in blood plasma. Okay, so intracellular fluid, extracellular fluid. Extracellular can be divided into interstitial fluid between the cells and the plasma of the blood. And so these liquids then are going to have pressures. Okay, and so we're going to talk about these different kinds of pressures, two types of pressure. And these are used to determine fluid volumes and movement of water in and out of blood vessels. The first is hydrostatic pressure, which is the force of a fluid on the surrounding wall. And the second is called colloid osmotic pressure. And this comes because there's more protein in the blood than there is outside, and protein is too big to leave the vessel. Okay. So we start to measure this. We measure it as net liquid either leaving or going into the capillaries. Okay, so here's a capillary in our bodies, right? The arterial blood flow is going this direction, and then the blood comes down back. The venule goes back to the heart. When liquid is coming out of the capillaries, it's called filtration. When it's going into the capillaries, it's called absorption. Okay, so when you have absorption from the interstitial fluid to the capillaries, that's going into the capillaries. When you have filtration, you have liquid leaving the capillaries going to that interstitial fluid. And so then we essentially have this equation that we're going to plug things into. Okay, so we are going to take the fluid out, which is calculated by the hydrostatic pressure in the capillary, that's PC, plus pi I, which is the colloid osmotic pressure of the interstitial fluid. Okay. Then we take away the hydrostatic pressure of the interstitial fluid plus the colloid osmotic pressure of the blood plasma, because that's the amount of fluid coming in. So this is net filtration and net absorption. Okay. And so what we see here, we plug some numbers in. Let's imagine that this hydrostatic pressure of the capillary is 37, and the colloid osmotic pressure of the plasma is 25. We can take the interstitial fluid in the tissue with hydrostatic pressure of that fluid being 1 and the colloid osmotic pressure being 0. And we plug it in like this and solve for the equation. We get a number that favors filtration. Okay, so when you get a positive number, that's net filtration. So it's favoring filtration. When we take some different numbers, solve our equation, and end up with a negative number, that is favoring absorption. So if you plug things into this equation and get a positive number, that's filtration, and you get a negative number, that's absorption. Okay, so let's think of an example. Say you have a patient with liver failure, so they're unable to make enough blood plasma protein. What effect do you think this will have on their net filtration pressure? Well, if they don't have enough blood plasma protein, the colloid osmotic pressure of the plasma would be lower than normal, so this would increase net filtration. And we can see that by an increase, a more positive number than due to liver failure. So if normal is going to be this 37 minus 26, so 11 millimeters of mercury. And the 16 then, due to this condition, now we have a higher positive number. Positive is going to favor filtration, so we have an increase in filtration then in this case. Okay. So the next thing we're going to talk about is regulation of blood pressure. And essentially, this is going to be a whole lot of hormones. Okay, so here's a list of hormones, and I'll talk through them all too in the next slide. But we've got lots of hormones that are going to regulate blood pressure. And this probably should tell you exactly how important blood pressure is. Okay, the first one we're going to talk about is called atrial natriuretic factor or hormone. So it's abbreviated as ANF or ANH. And the atria of the heart release this hormone in response to high blood pressure. So if blood pressure goes up, the heart releases ANF. And this tells kidneys to increase excretion of sodium. So you're putting more sodium into your urine. Water then follows the sodium in your urine. You pee out more water, and that's going to lower your blood pressure. Okay. A second hormone that regulates blood pressure is called ADH, antidiuretic hormone, also called vasopressin. So remember, this is one of those hormones that comes from the posterior pituitary. This hormone causes an increase in blood pressure by reabsorbing water. Okay, so it's going to have the opposite effect of ANH. It's going to increase blood pressure by reabsorbing water, whereas ANH or ANF is going to tell you to dump water out in your urine. And finally, we have this system of hormones called the renin-angiotensin system, and these are the hormones that control aldosterone. Okay, so renin is an enzyme released by the kidney in response to low blood pressure. So blood pressure gets too low, renin is released from the kidney. That causes conversion of angiotensinogen to angiotensin 1. And an enzyme called ACE converts A1 to A2. That's angiotensin 1 to angiotensin 2. So now we have conversion, essentially activation of this angiotensin 2 hormone. Angiotensin 2 then is a systemic vasoconstrictor. Okay, so it causes vasoconstriction, which helps to increase blood pressure. It also tells the adrenal cortex to make aldosterone. Aldosterone is going to increase sodium reabsorption in the kidney, and water follows. So what you'll note is that we've got a whole bunch of hormones to deal with low blood pressure, right? So ADH and renin, angiotensin 2, aldosterone are going to be activated in response to low blood pressure that help you increase your blood pressure. The only hormone that's going to control high blood pressure is ANF. Okay, so this is everything I just showed you in just a picture format, okay? But I like this figure because it shows what's happening then to increase blood pressure, right? And it also talks about some of the behavioral aspects. So here's vasopressin, or ADH, coming from the pituitary gland. Here is the kidneys releasing aldosterone for sodium reabsorption. Also an arterial or vasoconstriction, okay? And I want to point out here too that one more thing that happens when you have blood pressure changes is going to be the brain. So in response to blood pressure, you can have sympathetic activation and thirst, which can help you increase your blood pressure. Okay, so there's lots of ways in which you can increase your blood pressure. And certainly these are things that we might think about blocking when we're thinking about lowering someone's blood pressure. Okay. So the kidneys here are the main place where we're regulating blood volume, and regulating blood volume is a direct way to regulate blood pressure. Okay. So hormones command the kidneys. Now let's think about this. Antidiuretic hormone, that hormone from the posterior pituitary, increases water reabsorption in the kidneys, so blood volume increases. Aldosterone increases salt reabsorption in the kidneys. Water follows the salt, so blood volume will increase. So these hormones together help you increase blood pressure by separately controlling water reabsorption and salt reabsorption. This is another way of looking at the system, renin-angiotensin system. Renin signals production of angiotensin 2. Angiotensin 2 signals release of aldosterone. We just talked about the actions of aldosterone being a retention of sodium, so blood volume will increase. ANF, produced by the atria of the heart, increases salt excretion into the urine. And when it does this, water will follow salt into the urine, pee out that urine, and so blood volume will decrease. So this hormone relies on this basic principle of diffusion where water is going to follow salt. If you pump salt, increase excretion of salt into the urine, water will follow, blood volume will decrease, and therefore blood pressure will decrease. Okay. So mostly that blood pressure then is controlled by blood volume changes from those hormones. And we also see wildly different pressures then across the vessels in our systems. Okay. So in the left ventricle of the heart, that main pumping ventricle that pumps the whole body, we see huge pressure changes, right? So when the ventricle contracts, huge pressure. When it relaxes, low pressure. So we get this pumping pressure. The left arteries then mirror that, up, down, up, down, up, down, up, down. But you note that they never bottom out. So there's always some pressure maintained in those arteries coming out of the heart. Okay. And arteries are going to have the highest pressure of vessels in our body. Okay. As you get to small arteries and arterioles, pressure goes down. These are called resistance vessels. Okay. The capillaries, where you have the exchange vessels. Remember, the capillaries are where you have exchange of solutes and water and waste products, oxygen, all kinds of things with the tissues that they're embedded into, right? And so there's lower pressure in capillaries, and then really low pressure then in these capacitance vessels, which we call the venules and veins. Okay, and then when that blood finally makes it back to the heart, then this happens again. Okay. So blood flow, we have to follow these principles of fluid dynamics. Blood flows from high pressure to low pressure. And so pressure changes throughout our circulatory system. Now we got to think about a little bit of physics here. Flow is a function of the pressure gradient divided by the resistance. Okay. So flow is volume of blood over time. Pressure then is the force of the fluid on the vessel wall. And resistance is the opposition to flow. Okay. So let's think about this. If pressure increases, what's going to happen to flow? Pressure increases, flow will increase. If resistance increases, flow will decrease. Okay. Let's think about this case study here. Marion has been diagnosed with breast cancer and is about to receive surgical treatment. The doctor tells Marion that there will be removal of her right breast and right axillary lymph nodes. The doctor then warns Marion that a side effect of the surgery may be a swollen right arm. So Marion asks you, well, why would it be swollen? So think about this. Think about this movement of liquid and flow and why her arm might be swollen then after removal of axillary lymph nodes in her right breast. Okay? You're welcome to come see me in office hours. Come talk to me about this problem and think about this issue. And next time, we'll talk about the rest of chapter 14. So I'll see you then.